Hello, welcome to Facebook Live about awareness on congenital heart defects. On this program, we are going to talk about congenital heart defects, diagnosis, treatment, risk factors. As this covers it's a week regarding awareness of the congenital heart defects treatment. So basically, the congenital heart defects are a group of heart defects which affects millions of the newborn infants and children. It is the most common congenital problem which causes serious morbidity and mortality if not diagnosed early in the life. So we have three people with us now. Dr. Sagar Lad is going to introduce about himself.
I am Dr. Sagar Lad. I am a senior pediatric intensive care specialist and neonatologist working in Jehangir Hospital since last 15 years. And we usually take care of sick children in the ICUs and the neonatal ICUs.
Thank you, Dr. Lad. Now, Dr. Anshu Sethi.
I am Dr. Anshu Sethi. I am a consultant pediatrician and neonatologist working at Jehangir Hospital. We look after all our sick babies in the neonatal ICU, and we have a wide range of conditions which we can treat here.
I am Dr. Manglesh Shravan Nimbalkar. I am a consultant pediatric and fetal cardiologist, which we treat fetuses and children affected with congenital heart defects. Now, this is a discussion where we are going to talk about congenital heart defects and then we will take questions after this discussion. Dr. Sagar Lad, this is a question to you. What you mean by congenital heart defect?
Now, the congenital heart defect, as the name implies, is a congenital. It is at a time of a birth. There are varieties of congenital disease at a time of a birth, but out of that, congenital heart disease is a defect which is developed because of the development of the heart, that is development of the chamber of the heart, vessels in the heart, or the communication of this heart to the rest of the body system. That is a congenital heart defect. And why we are so much worried of this congenital heart defect? Because the manifestation of the children are varied. So as name implies, congenital may not be present at the birth, but may be present later on also. That's why we need to aware of this disease. The basic aim of this program is to make the aware of the people and the society, yet this disease is very common in children and you should not ignore it.
Thank you, Dr. Lal. Now, as you know, congenital heart defects in babies can't talk. Now, we have to suspect this beforehand. Now, how do you suspect as a parent and as a doctor? These questions to Dr. Anshu Sethi.
And that's a very important question. As Dr. Sagar rightly mentioned, structural heart disease may be present at birth or it may present at any time in infancy or early childhood. However, there are certain pointers which parents should be aware so that they can suspect that a child has congenital heart disease. One of the early pointers in a neonatal period is when the child has or neonate has feeding difficulties, like feeding problems, like the child has a suck, rest, suck cycle. That is, the child feeds, takes rest, that the child has interrupted feeding. The second very important pointer is failure to thrive. If the child comes to a pediatrician and is following up regularly and there is a faltering of growth, in the growth charts the child is persistently falling below the 3rd percentile, besides other causes like poor nutrition, we should keep a structural heart disease in mind because of the heart disease, a child may have failure to thrive and a poor weight gain. The third other pointer is that the child may have persistent breathlessness, difficulty in breathing, which the parents may notice that the child has persistent tachypnea or a fast breathing rate. If the mother puts her hand on the heart or the precordial, there may be a bulge or there may be a fast heart rate. The other thing in an older child is the child may get fatigued easily. When the child is playing, the child may get tired. If a child has frequent LRTIs or frequent pneumonias, frequent hospitalization, this may be another pointer that the child may be having congenital heart disease and may require to visit a pediatric cardiologist. And lastly, the heart diseases may be of two types, cyanotic and acyanotic. The cyanotic heart diseases may also present with a blue baby, that is, a child may present with cyanosis of the lips, the skin and the nails, which increases on crying, and that warrants immediate investigation and visit to a pediatric cardiologist. So these are fair signs and symptoms which a parent can notice. Besides that, in the neonatal period, as soon as the child is born, we make sure that the child is not cyanotic, has no blueness, there is no presence of precordial bulge or murmurs, and there is four limbs pulsations felt, and the pulse oximeter is above 95. So these are the common sign symptoms which we should look out in the infancy and childhood, which warrant an immediate referral to a pediatric cardiologist.
Thank you so much, madam. Now I'll just correct ma'am a little bit. The last moment, ma'am has said if a parent has detected some bluish tinge in the patient, it's always better to visit your doctor. Your doctor is very important, because visiting a doctor is important, because a pediatrician and neonatologist, they know how to care for the children. Visiting a pediatric cardiologist will be little difficult, because what happens with the neonatologist and pediatrician, they have they keep on seeing normal and abnormal babies. If they suspect a heart disease, they generally refer to us. Thank you.
So one more thing, that mother is the best person who usually see. If mother feels that there is a change in behavior of baby, sometime while feeding the baby get excessively sweating. There is excessive sweating, and baby doesn't gain the weight. When they see the other babies in the community or in nearby or in the family, this baby doesn't grow. So all the time it is not congenital heart. It is one of the reason is a congenital heart defect. So don't become immediately panic if the baby is something else. Better, as Dr. Nimbalkar said, consult a pediatrician. Pediatric is the best guide. He will guide you whether really the baby had some heart defect and we need a intervention or evaluation further.
Thank you, Dr. Lad, for correcting. So here the message to take home message is very important, that whenever as a parent, whenever you feel your child is not normal, you compare with the sibling or the previous child, you compare with them, and whenever you compare with these children, you will notice that there might be, you might suspect you suspect little difference in behavior of this child, little bluishness. Then visit your pediatrician. They will guide you to come further. Now,
as Sir and Dr. Sagar said, regular visits at childhood with a pediatrician, monitoring of growth, and even any parent has any suspicion, immediate visit to your local pediatrician is mandatory.
Very good point. See, the growth charts, what generally the pediatrician follow, the Indian Academy of Pediatrics growth chart, they are very good, and like Indian standards, they will compare. And very important, if the baby is lagging behind, they will first rule out the congenital heart defect as a cause for this failure to thrive. This is important. Now, Dr. Sagar Lad, I see many children, they come to us and they ask first questions. What happened, that somebody has told us this, the other baby had a hole, it get cured. Now other baby had a bluishness, that patient went for operations. So we don't know what is causing, what are the types of the heart defects. So can you just elaborate to us as a educational tool, that how should we categorize the heart defects? How many types of the heart defects are there?
Now, basically, when you suspect a congenital heart defect, definitely need to find out in which category child is fitting. There are various. First, already Dr. Anshu Madam has told there are two types. It is a cyanotic and acyanotic. What is mean by cyanotic? If the baby is becoming blue, it indicates a cyanosis. There is a mixing of some chamber in the heart. Oxygen and deoxygenated blood, it gets mixed somewhere in the heart at different level, that can cause a cyanosis. Now, cyanotic heart disease is something different that you immediately need of evaluation, because usually growth faltering is more in the cyanotic heart disease. So this cyanotic heart disease can be happen in any chamber of the heart or a blood vessel which is coming from the heart. So this is called as a cyanotic heart disease. Usually cyanotic heart defect present at a birth immediately need a urgent intervention that can be a life-threatening to the child. Second category, that the baby can present at 2 year, 3 year as a cyanosis whenever there is a mixing of the blood or there is obstruction in the flow of the blood from the heart. They can be detected 2 year and 3 year of the age, and other categories are called as a cyanotic heart disease. Now this cyanotic heart disease, there is no chamber mixing, but there is a overload or the heart is full of blood and heart has to pump that large amount of blood. And if there is a problem in the heart, like if the heart muscle is weak, or if there is a mixing of chamber in the chamber, what we call it as a ASD or VSD, that a connection at the atrial level or connection at the ventricular level, this baby may not become blue, but they get over blood either in the lung or in the circulation, so they can get a repeated lung infection. So specifically a child getting a recurrent pneumonia, one of the pointer that might have a cyanotic congenital heart defect. Second possibility may be about a valve defect, like sometime you can have a congenital problem in the mitral wall or tricuspid wall. These are one of other possibility. And third thing is about a pumping called as a dilated cardiomyopathy or cardiomyopathy. This, if there is a developmental issues in the heart muscle itself, heart cannot pump up properly, that can cause maybe the ejection fraction, what we call as a pumping capacity of a heart, can become less, like normally like 70-80%, it can come down to 10 and 20%. With that coping, the heart or body cannot cope up with this, and this is also called as a dilated cardiomyopathy. Usually these are the congenital in origin, but sometimes it may be the acquired secondary to the viral infection, or we have seen some cases after COVID also. So which is unusual but can present less than 1 year of age. So by and large, categorizing a child with a cyanotic heart disease need urgent intervention, evaluation by the expert pediatric cardiologist, and a cyanotic heart disease, whether we have a mixing of the blood that can present later on in the life, we need a further evaluation.
Thank you, Dr. Lad. It was a good explanation. Now, whenever we see in OPD, we always tell, okay, this is your diagnosis of your baby. And what happens is parents get panicky and mothers feel responsible, and they think it is their mistake to have given a birth to a child with a congenital heart defects. And some families, they brand them criminals. So now, what is this? What are the factors which in mother, if they are there, can cause a heart defects in the child? That Dr. Anshu Sethi will answer.
Thank you. Yeah, this is a very important question to address. There are certain genetic factors which may be responsible for the genetic cause of the heart disease. There are certain syndromes which may be associated with a higher risk of heart disease in the babies, like Down syndromes, Williams syndromes, and etc. However, some heart diseases also may occur due to spontaneous mutation, and there may be no cause which is present in the family. However, if there is a family history of heart disease, or there is a heart disease in the siblings or in the cousins, then there is a recurrence rate. If the previous sibling has had a heart disease, there's a recurrence rate of almost 2 to 5%. So in the repeat pregnancy, the mother has to be antenatally screened with a fetal echo very early at around 17 to 19 weeks by a pediatric cardiologist, which is available in our center at Jehangir Hospital. The other causes or the other risk factors for causing heart disease could be maternal diseases like uncontrolled diabetes, or any risk of infection in the mother, elderly age in the mother. There may be rubella infection if it has occurred in the early pregnancy, some medications which the mother is on which are harmful to the baby, and lastly, if the mother has had smoking or heavy smoking. These are the risk factors which predispose the mother. However, these are just risk factors. There may be just causes which has occurred without any reason, and that may be a spontaneous mutation. So most important is, if the mother falls into a category in which there is a high risk pregnancy, it's very important to undergo a fetal echocardiography at 16 to 19 weeks by a pediatric cardiologist.
Very important message Dr. Anshu Sethi madam has given, because what happens in a child, in a fetus which is referred after third trimester, that means late in the pregnancy, we cannot diagnose them early. If we diagnose them a critical heart disease like a hypoplastic left heart disease there is no good prognosis for this. Even though we operate, the baby is going to die. Those cases, if we, as Dr. Shetty ma'am has pointed out, before 20 weeks of pregnancy, if we can diagnose them early, we can send them for termination and the mother can have the next good baby. So this is very important point. Now, whenever we come in the OPD, we always tell people, see, this is your heart problem. Now, they say, sir, the X-ray has been done, ECG किया था, हम बहुत सारे डॉक्टर साहब के पास जाते हैं, आम्ही या डॉक्टरांकडे गेलो, आम्ही त्या डॉक्टर कोणी सस्पेक्ट केलं नाही आणि एक कुठल्या तरी डॉक्टरांनी सांगितलं की आवाज येतोय आणि मग आम्हाला पाठवलं. अब हे आधी करता येत नव्हतं का? सो उनका प्रॉब्लम क्या रहता है कि ये पहले ही नहीं कर सकते थे क्या, जिससे हम बच्चे को 7 साल में, 8 साल में, 10 साल में से लेट डायग्नोसिस से अच्छा ये पहला डायग्नोसिस होता था. तो सागर लाड सर से यही रिक्वेस्ट है कि सर, हाउ कैन यू डायग्नोज दिस कंजेनिटल हार्ट डिफेक्ट विथ सर्टिनिटी?
See, as such, there are subtle signs. So when a patient comes to the OPD to the pediatrician, there are some clinical acumen, then you can suspect it, and that can be confirmed by a echocardiography. Gold standard is echocardiography, but when you suspect, majority of a congenital heart disease has got a murmur. Murmur is a voice which is produced in the heart when the heart hit against the blood vessel or the wall. But it is not like that. Sometime in 4 to 5% of the patient having a congenital heart disease may not have a murmur also. So murmur is a subtle sign, but on the contrary, parent also need to see कि बाबा baby grow नहीं हो रहा है, baby recurrent pneumonia हो रहा है, baby का sweating ज़्यादा हो रहा है. So these are the other factor that only murmur. Sometimes you can get an innocent murmur also without any sequelae. Murmur है, valve आपके यहाँ blood आवाज कर रहा है और echo normal भी रह सकता है. So clinical acumen you can diagnose, but it is like a balance. When the balance in the body get tilted, the body shows some sequelae or some information or some symptom. So in initial part, 1 year, 2 year of age, if the body is coping up, even underlying heart disease may not manifest. So it is not like that. अगर वो बर्थ से है और डॉक्टर साहब को 2 साल पता चला है, बीच में कहीं डायग्नोज नहीं हुआ, ऐसा नहीं होता है. प्रॉब्लम जब आता है जब बॉडी सिम्टम दिखाना चालू करती है और मरमर दिखाती है, मरमर नहीं भी रहा, अगर बेबी ग्रोथ नहीं हो रहा है, देन डेफिनेटली वी सस्पेक्ट एंड वी डू द इको. सो डायग्नोसिस इज बाय क्लिनिकल acumen and presentation at any type of age, but once you suspect, it's better you evaluate and you get treated.
Very good point. Now that is because what happens that a baby is born somewhere else. Now their doctors checks, because a pediatrician is a very sincere doctor as per my opinion, because I'm the pediatrician. We give importance to even a small details, because baby can't talk. We have to diagnose beforehand. So whenever we see a baby, we have to examine them. Now our diagnosis based on the fact that if there is a deviation, then only we can refer to the for the 2D echocardiography. Every baby we can't refer to for 2D echocardiography, but it happens that some of the heart diseases they don't present at the time of birth. They present later, as Dr. Sagar Lad has pointed out. So very important is whenever they suspect, it is important to go for 2D echo and get problem diagnosed as early as possible. Thank you. So my next question is, with certainty, now this is a clinician, yes, we know that now we are suspecting the heart disease. Now what you should do next, that is important. Dr. Anshu Sethi, what we should do now? We are very sure that this baby might be having a heart disease. Now what we should do?
Like we pointed out, the early sign symptoms are there, and we have noticed some subtle changes in the child's weight, and the child is sweating, the child is getting repeated LRTI. Once we have suspected, we should immediately run some tests, because only fetal echo means the echocardiography is the gold standard to diagnose the congenital heart disease. Congenital heart disease may not be present at birth. Depending on the heart lesion, it may present in early childhood, infancy, and sometimes ASD may even present in later childhood. So we have to keep a high level of suspicion. But as sir said, the tests on any suspicion, we have to run the tests. Echocardiography should be done, X-ray when warranted, ECG, and immediate referral to a pediatric cardiologist. In the OPD, we can do a pulse oximeter, we can see the four limb pulses, and we can see a difference in the saturations in the upper limb and the lower limb. Plus, we can notice if there is a murmur and clinical checkup. This will be the early pointers. And echocardiography is mandatory.
So the other things that usually what nowadays we do newborn screening, we do a four limb blood oxygen saturation called as a SpO2 monitoring. This is called as a critical congenital heart disease, like a disease which are life threatening. There are 4 or 5 life threatening congenital heart disease which are detected at the time of a birth, and if you do the surgery immediately within 72 hours, they are life saving. So it is a universal program that you check the baby's oxygen saturation called as a 4 limb saturation after the birth, 12 hour and 24 hour at a time of a discharge. And is there any disparity between a saturation of upper limb and a lower limb, right upper limb, right lower limb more than 5, then you think that the child may have some mixing in the heart and might have a critical congenital heart defect. Now this is the new thing that has come up, and because of this evaluation, what we do in Jehangir Hospital, all the babies who are discharged, we do the pulse oximeter monitoring, and because of that, at least 2 to 3% of babies can pick up in the early period and can get evaluated further and can recover. So this is called as a evaluation for a critical congenital heart disease. More information Nimbalkar sir will tell you about all these diseases.
Thank you. So we will talk about after we have suspected, we have diagnosed. Now very important is diagnosis should be based on a very good 2D echocardiography machine. It should be advanced machine. We cannot do this in the at the local level, village level. You should have a proper infrastructure for this, which is present in Jehangir Hospital. Here we do fetal echocardiogram as early as 16 week, and by 16th week 90% of the children, the fetuses, we can diagnose with the heart disease with these advanced machines. Similarly, 2D echocardiography machine also is very important. You need to have a high-end echocardiography machine to diagnose small miniatures but significant heart problems. That is important. Now, talking about treatment, I think we have started since I came in 2009. We have started and we have treated plenty of children with congenital heart defects, and I understand that maybe 5 of them we have treated on day 1 of life. The balloon coactoplasty for stenosis of the aorta, which is the bigger vessels, and we have done a balloon pulmonary valvotomy, balloon aortic valvotomy for those significant stenosis of the walls. I think the treatment modalities differs. The treatment model is based on the 2D echocardiogram. As Dr. Sagar Lad sir has pointed out, there are simple heart defects and there are critical heart defects. Whenever you have a critical heart defects, it is important to diagnose them, and the treatment will be as per the nature of the heart defect. Some of the critical heart defect, like transposition of great vessels, the total anomalous pulmonary venous drainage, those critical heart diseases, if they are detected early by fetal echo, we can provide them in hospital treatment. The mother will be the ambulance for the baby instead of delivering outside at the village level and get the death of the neonate at the village level. It is important that you should deliver these patients, these mothers with baby's heart defect in the hospital, where the neonatologist will take over and they will immediately start medicines, and which will keep open the ductus arteriosus patent and save these babies. Now the treatment modality differs. Now if there are serious heart defects, they need to be treated as early as possible. The majority of the children, they undergo surgical correction. The surgical correction, there are many centers now. Into 2024, we have a very good centers in Maharashtra, and I believe Jehangir is one of them. Hospital where we have treating critical heart disease patients, and the prognosis for these critical heart illnesses, if operated early, is more than 95%. Now coming back to the simple heart defect, we generally wait and watch for them, and when they are over 3 to 5 years, if the hole doesn't get closed, we offer them interventional, that angiographically close heart operations, where we treat them in a day, we discharge them, because we have a very fantastic intensivist with us, and we rely, even though we are a cardiologist and we have cardiac surgeon, the main support is from the ICU team. Very important. That should be the that should cover our treatment part. The we have offered the simple patch closures, the critical heart illnesses operations also, and majority many patients now, mostly 400-500 patients have got cured with these operations in this last 2-3 years. Thank you so much. We will take questions now. Now welcome to the question sessions. So swagatam.
Now, the first question is, hi, my 2.5-year grandson having cold and cough mostly on a week interval. Is it fine giving a paracetamol and a cough syrup whenever he suffers from fever and cough, always having a runny nose too? Are there any special diet or food that can help the child's heart healthy? So we will first, ma'am, can you just answer this question? The question again revised in 2.5-year grandson, and is getting a cough, and they are asking should he continue to give a paracetamol and cough syrup.
A symptomatic treatment can continue, but as you said rightly, if the child is getting frequent cough and cold, we should investigate the child. Is the child having allergies, or is the child having growth faltering, or is it just because of just allergic problem or poor nutrition? And then just giving only cough syrups is not going to solve. We have to notice that whether it's an allergy or whether it's an infection, or is there any underlying problem in the child.
Yeah, rightly said, ma'am. I think it's better to get evaluated by the doctor. Just don't Google the symptom and treat the child accordingly. I think it's better you get it checked. Being a 2.5-year-old child is better get seen by the pediatrician, and you need to find out the root cause. What is the reason of a cough, and what is the reason? Don't give just blindly medicine. Now, second question: are there any special diet or food that can help the child's heart healthy?
Very important question. Post-COVID, I think there is a surge in this. I think there are plenty of material, plenty of advertising going on, and everybody wants to have a good heart, healthy heart. That's good. Now, whatever we are seeing in post-COVID era is two patients. Now, one children, they sit at home, do nothing, watch TV 4-5 hours per day, no activity, and very important for them. As early as we have a 17-year-old with coronary artery disease, a disease affecting the heart. You might have heard the older children get a heart attack, but now this 17-year-old got a heart attack, and we could save them in time, because we never suspect a coronary artery disease in this younger population. But why we could do? Because we could take a history and we could find out that baby has gained 30 kg weight. His lipid profiles are so bad. We have started 3 medicines for this kid. Now, very important is your activity, your exercise. In our generations, our father was very hell-bent on, no, you have to do exercise, you have to walk, you have to do you have to eat nicely, you can't go and have a bad food. So very important part of our education was go exercise, eat healthy food. That is very important. And I think Indian Academy of Pediatrics, the pediatrician neonatologists are very good source, a point of contact, where they can give a diet advice, And I think Dr. Anshu Sethi will elaborate on what, because even though this is the cardiology, I am in the dead end of the spectrum. Now everything starts with prevention. You have that adage that prevention is better than cure, and this starts with a pediatrician.
That's a good point, well taken. I think it starts right from the antenatal period. Mother should have a healthy diet, visit a gynecologist, start folate supplementations early in pregnancy. Folate supplementations will not only prevent neural tube defects, but they've also shown for prevention of heart disease. So mother can be supplemented with good diet. They can be having folate supplementation with the advice of the gynac. Mother should give breastfeed exclusively, which will help to build up immunity. And as sir rightly said, even balancing a diet, avoiding junk food, outdoor playing, and having balanced diet with carbs, proteins, vitamins, micronutrient supplements, and lots of sunlight will help the child in early childhood.
Madam, what are the folate you have mentioned, but what are the where we find this folate?
Folate can be even found in vegetables, but in high-risk pregnancies, it is advisable to supplement the mothers starting even preconceptional folate.
Important. So periconceptional period is very important. Lot of diabetic mothers, they come to us and they diagnose it little late, and we, because as Dr. Sethi has pointed out in the risk factor, that maternal diabetes mellitus has a high risk factor for congenital heart defects. We need to give advice to the couples before they even think of getting pregnant. See, this is very important. Periconceptual period means 3 months before the delivery of the fetus, we should have this advice. And very important is that maternal health should be very good. It should be cared by a physician.
Okay, so rightly said that there is no specific healthy heart diet, but all the diet which is healthy for a child keep your heart healthy. So give a proper nutritious diet to the child and no junk food. Now next question to ma'am, what are some risk factor for developing heart problem in childhood? Means, is there any risk factor for developing heart problem in childhood?
Risk factors would include, of course, a previous sibling, and as we rightly said, the risk factors could be genetic if they have a syndrome. Maternal factors may be also contributing if maternal diabetes is uncontrolled, if mother has any strong medications which have caused some heart disease. If these are all ruled out, then the child having heart disease as such can be diagnosed at birth, in infancy, or they may present even later. But of course, from our side, we can see that there is no genetic syndrome or no chromosomal abnormalities.
Very good, very good.
So, rightly said, these are risk factor. Risk factor can be mother. As such, these are congenital heart defect. Congenital heart defect come from either a genetic called as a epigenetic. Epigenetic matlab the environment can promote or leads to the development of the heart problem in the baby. Genetic along with some epigenetic factor. So like using the tobacco or using alcohol or using smoking in a pregnancy can precipitate, as rightly pointed out by the madam. Now next question, where can parent find a reliable information and a support network if their child has a heart condition?
Okay, now this is very important. I think this is the part where we want to create awareness about heart disease. Nowadays, when we were learning our pediatrics, every time we used to send it to either Bangalore or other places. Even 2009 when I started in Jehangir, we have had to send so many kids outside because there were no proper centers. Fortunately, in Maharashtra, there are now 8 to 10 centers available. Very, very important is now we have, till now we didn't have good charity support, but nowadays we have a very good charity support at Jehangir Hospital with help of many charitable trusts, Rotary Club. So this charitable support has given us so much ease the morning patient gets echoed, diagnosed, and in the afternoon it gets sanctioned. It is so fast we can support them. So there are plenty of support groups available. Now we have pediatric cardiologist is the person where we have this where he can guide you. If not, we can reach Jehangir Hospital number, which is Jehangir Hospital, for information about the charity support, and we certainly will certainly guide you and treat this kind of every heart disease possible at our center.
Yes, thank you. So basically, if you have need any information and support network, you can contact us and we will give you all the information. Now, next question to madam: can a kid with asthma develop a heart problem later?
That's a good question. Usually, asthma is a predisposing factor for repeated allergies, and they can develop repeated LRTIs. So, early treatment of asthma will not only help the child to have proper infection control, but will also have good weight gain. Plus, the child will remain healthy if the asthma is under control, and they'll prevent frequent infections. Congenital heart disease as such may not be associated with asthma, but if a child has congenital heart disease, the child can have repeated LRTIs and the asthma may get aggravated. So there is a strong correlation between LRTIs, asthma and the heart disease.
Very important factor is, as madam has said, the congenital heart defects now is present in asthma will make asthma and the congenital heart disease both bad for the baby. What happens in these patients, whenever we find most often if we diagnosed a congenital heart defect, most of the times the atrial septal defect, that is what Dr. Sagar sir has categorized as a simple heart defect. The baby appears normal to you. Everything is normal. The growth is normal. Baby is playing outside, and now baby come to us and we tell them, yes, you have a hole in the heart. Now first the parent starts questioning ourselves, is that why you could not detect it previously? Is because it is a simple heart defect. It is a simple hole. Now, whenever we have a simple atrial defect in the babies, they will present as asthma episodes. Now they will mimic asthma. Now in those, the best differentiation would be to send these babies for the 2D echocardiography, where if normal heart is there, we can give the asthma treatment. If they are there, then we have to treat the heart defect. In addition to, we have to treat the asthma part. Now here in Jehangir, very important is whatever cases we have admitted and we have treated at a case with the large defects, majority of them, they need a respiratory support. And it is very important that Dr. Sagarlal and Dr. Anshu Sethi should take care of those after we correct them, and that is very important because allergies are important part and they need to be treated. We have had so many cases where we have treated and still baby had asthma. So better people, where is the pediatrician treatment?
Okay, thank you. Next question: what role does a genetic play in pediatric heart issue, and are there things parent can do to lower the risk?
That is very important point Dr. Anshu Sethi ma'am has point. Peri-conceptional period. That means whenever you are thinking of starting a family, very important, that time starts, and you have to have a mother screening for sugar, diabetes, hypertension, the SLE, the autoimmune diseases. There we should tell them. Then second thing is fetal alcohol syndrome, because of the smoking, the fetus has problem. The precautions are important. So these are the things. Now advanced maternal age, yes, you can have. Nowadays the system is like 36 years, 38 years, mothers get pregnant. It's okay, but only thing is very important is to diagnose to be sure that we are giving birth to a normal child with a normal 4-chamber heart. We should have a fetal echocardiogram as early as 16 to 18 weeks of gestation. Very important.
Okay, thank you. So next question: what signs should parent look for to know if their child might have a heart problem? Yes, sir.
These sign symptoms, as we've already covered in our earlier lecture, they may vary from being very subtle signs which we have just noticed, like poor feeding, sweating, suck, swallow, rest cycle, or in an older child, easy fatigability, repeated pneumonias, fast heart rate. So these all are subtle signs, but there may be definite signs like the child is falling sick frequently. So visit the pediatrician. Once the pediatrician notices that there's a murmur or something is not all right, immediate referral and early diagnosis and treatment pickup by the cardiologist, pediatric cardiologist, will help. Timely intervention is the main key. That will help.
Okay, this is all about the question. In a nutshell, our basic aim of this seminar with our eminent colleague Nimbalkar sir and Anshu madam, so it is a group of a team. Like treating a congenital heart disease is not a single man or one man show.
Very important.
It needs a multidisciplinary team which includes an expert cardiologist, a supportive tube by intensivist, and supportive pediatric ICU and neonatal ICU backup, expert nursing team and expert resident doctor, which need a 24-hour monitoring, and all expert cardiac anesthetic also, which are specially trained in a pediatric cardiac anesthesia. So at the Jehangir Hospital, since last 3-4 years we are running this program, but since last 1 year, which is in a Zoom, last 6 months we have done a lots of cardiac intervention by device closure by Nimbalkar sir. We have done a corrective surgeries by Dr. Kaushik, which even we have operated a case of a 6 month of a TOF which has successfully gone home. So these are the services which are provided at Jehangir Hospital. The basic aim of this seminar is to understand the people. Thus, there is an incidence of a 2 lakh children are delivering in a year. Not year delivering, but almost a 2 lakh children are delivered with congenital heart defect. It is quite a big number. It is just a tip of iceberg. There are many of these. So early evaluation, early detection, early treatment saves lots of lives of these babies. And here at the Jehangir Hospital, we have all the things available under one roof, which is present in the world. So whatever services are provided in developed countries, that services are available at our place to treat all this congenital heart disease. Do you want to say anything?
And sir said very rightly, the most important take-home message, of course, is a team, which is the most important here at Jehangir. And starting right from antenatal period, we also have an excellent department here. So we tag all the high-risk mothers, tag all advanced stage mothers, and we encourage all mothers to undergo, who are at high risk, a fetal echocardiography very early in pregnancy, so that there is timely intervention. And once diagnosed, of course, we have an excellent team over here which can help them.
I like to add.
One question that has come now is just repeat after I get it. If any CHD patient gets collapsed and needs CPR, is there any difference between CPR in normal children and normal patient and CHD patient?
So if you have got a diagnosed case of so the question is that if you have got a child with a known case of a congenital heart disease and he suddenly collapsed and he need a cardiac resuscitation, is there any difference? Definitely there is some difference, because if you know the child has got congenital heart disease, what is the reason of a sudden collapse? So you call it as the EMS, that is emergency medical system activation, if it is available, or if it is in a child, it is better to put the child on a defibrillator and see the rhythm. So majority of the children develop a ventricular fibrillation. It is a rhythm that urgent need a shock. So usually of majority of places like in developing countries, in India also, at railway station, at the airport or in the school, this machine is available. Best thing, if you see such child, call for the help. If it is in the airport, put a monitor and see the rhythm, and you can give a shock to this child. Second question, if there is nothing this is available, resuscitate the child. Do a cardiac massage. It is more become a scientific, but for general people, if you find the child there is no pulse, is a no heart disease, you just give a basic life support, give a cardiac massage to the child, and in technicality there should be a ratio of 15 chest compression and the 2 breath. It become more technicality, but the best way, if you find a child who is a collapse, you give a cardiac massage to the child.
Very important. And majority of the parents, they ask us same thing after operations or before operations. They say, sir, this child has a heart defect, now you have to get admitted. We tell them to see, these are the difficult time, and this is the heart defects which needs operation. Yes, but in the meantime, if patient gets into problem of collapses, the best way to see this is on the YouTube. We have a videos known as Pediatric CPR by IAP, Indian Academy of Pediatrics, by American Academy of Pediatrics. Best way is Indian Academy of Pediatrics. If you see this video 10 times, the 11 times you will be able to save a life. Very important by just seeing this. This is very important. These are practical issues. Yes, there are some differences in the resuscitation, but these are not for the normal, for the routine regular people. Routine people who, if they find a collapsed child or collapsed adult, they should start doing CPR, cardiopulmonary resuscitation, as advised by our Indian Academy of Pediatrics.
Thank you. This is all about the panel discussion. I will, Madam, do you want to give any take-home message about this program? So,
Thank you for joining in. I think we gave you all very important take-home messages. First of all, any suspicion, please visit your nearby pediatrician. Do not delay. Ask questions to your nearby pediatrician. If your child is diagnosed with heart disease, do not panic. We have here at Jehangir Hospital a team who will help you to solve all your queries. We even have the best center to help you with all devices, surgeries, everything. So we have a support team which will help you in all your problems.
do you want to give any take-home message?
Yes, as all us, we are very confident that as a team, as a tertiary cardiac center like Jehangir Hospital, we can tackle, we can treat, and we can save lives of the newborn with a congenital heart defect, with the children with a congenital heart defect, and even we are starting a fetal intervention program, fetals with the congenital heart defect. Now, till now, we didn't have many funds available to us, but since this year, we have plenty of funds in crores earmarked for this program, and now we are very sure that we will be able to give our best and give support to maximum children with the heart disease. Thank you, sir.
So, my take-home message: if you have got a baby with congenital heart defect, don't get panic. Take a proper advice. We are here to help you out. If you have got any question, you can contact to our hospital, or you can log into our website, and we'll provide you all the assistance. And thank you so much in a large numbers to attend in this Facebook update live. Thank you.